Consequences of taking drugs while pregnant. 1. Cocaine. Tracking the negative effects of cocaine use during pregnancy is a difficult task, mostly because of women that abuse cocaine will often have poor nutrition and inadequate prenatal care. It is known that cocaine exaggerates the normal cardiovascular changes you experience during pregnancy. Women consuming the drug are risking the development of severe hypertension, seizures, migraines, and separation of the placenta from the uterus, which puts a mother's ability to carry her baby to term in jeopardy. Your child may also be at increased risk of seizures, increased blood pressure, cardiac arrhythmia, and sudden death. 2. Heroin. If you use heroin while pregnant, you increase the chance of bleeding, especially during your third trimester, as well as preeclampsia, severe high blood pressure. You are also putting your developing fetus at risk of a premature birth, dangerously low birth weight, and death. Using an illicit drug like heroin also significantly increases your baby's risk of developing neonatal abstinence syndrome (NAS) shortly after birth, as well as sudden infant death syndrome (SIDS), also referred to as crib death. NAS is a postnatal withdrawal syndrome that impacts the infant with effects including irritability, excessive crying, breathing problems, gastrointestinal problems, and feeding issues. NAS requires intensive medical attention. 3. Marijuana. Contrary to popular belief, marijuana can be harmful and should be avoided when trying to conceive, during pregnancy, and while breastfeeding. While there is limited evidence on how marijuana use can affect a developing fetus, several studies suggest that its use may be associated with impaired fetal development, rare forms of cancer, premature birth, and low body weight at birth. Marijuana use during pregnancy may be linked to problems such as inattention, impaired decision-making skills, and poor academic performance. 4. MDMA Ecstasy. Studies suggest that fetal MDMA exposure during the first trimester can lead to long-term memory problems and impaired learning, as well as movement and coordination problems in the child. There have also been cases where babies exposed to MDMA while in utero developed cardiovascular anomalies and musculoskeletal problems. 5. Meth. It has been reported that exposing a fetus to meth can result in several long-term health issues, including issues with cognitive skills, physical dexterity, and behavior. Mental health problems including increased depression, anxiety, and social isolation have been reported in children exposed to meth in the womb. Some studies also suggest that meth use during pregnancy may be associated with congenital abnormalities, such as gastroschisis, a structural defect that can result in a baby being born with their intestines outside of the abdominal wall. 6. Alcohol. Even a small amount of alcohol consumed during pregnancy can place an unborn baby at risk, according to the National Institute on Alcohol Abuse and Alcoholism. Drinking alcohol can increase your risk of miscarriage and may result in a number of development issues in your child like fetal alcohol syndrome (FAS), the most severe example on the spectrum of fetal alcohol disorders. All fetal alcohol spectrum disorders involve negative consequences affecting the physical, mental, and behavioral health of your child, effects that can last a lifetime. Though there is no safe level of alcohol consumption, many pregnant women consume at least some alcohol during this time, believing that a small number of drinks will be safe. In fact, 500,000 children are exposed to alcohol in utero each year. 7. Cigarettes. Cigarettes contain harmful chemicals that can damage a developing baby's brain and can limit the amount of oxygen being received by the fetus. Also, the impact of nicotine on a developing baby is greater than the impact on the mother. According to the National Institute on Drug Abuse, nicotine concentration is up to 15% higher in the baby's blood than the mother's. Exposing your unborn baby to the tar, nicotine, and carbon monoxide in cigarette smoke can also result in a number of health issues after birth, including respiratory issues, cerebral palsy, and problems with eyesight and hearing. Sadly, not smoking yourself does not entirely guarantee your child's safety. Even being around others that smoke can affect your child, resulting in a lower birth weight, increased likelihood of developing a respiratory illness, and a higher risk of sudden infant death syndrome (SIDS).